Welcome back, everybody, to My Last Brain Cell. Happy October, man. We are officially, damn, we have 2 more months left in this year. That's so crazy to think about, yo. There's really 2 more months left. Yeah, we're in our first full week of October. That means spooky season is upon us. That means hopefully, if I'm a man of my word, you've already had a few days of a couple of shorts. You got a bunch of cookie videos from me from Half Baked Cookies because they had a bunch of Bills themed cookies for the week created by the consumers. It's been a good week, man. It's been a good week. But anyway, happy Tuesday to all of y'all. As you can see, I got something on the table, something real different. So if you'll recall, a few weeks back when we introduced Simon Says as our like thing to do with our hands, I said don't get too used to that. Yeah, I made sure to forewarn you to not get too used to it. And it was because I was planning on doing something a little different for the month of October. You will still get your typical clandestine cuisine episode. You will still get your typical sip, read, repeat episodes, but for your typical episodes, unless I decide to do a Puzzleverse episode, which I might, solely because I've been making some really good progress on the side by myself, and I really want you guys to be there for the completion of it. But unless I decide to do that, we are going to play this, and it's called Medical Mysteries New York City Emergency Room. And the name of the game, it's a cooperative, or you can play by yourself, medical mystery game, and your patients' lives are in your hands. Work together as a team to unravel mysterious medical cases and help your patients survive the night. The clock is ticking. And as I was reading this description at the store, I thought to myself, this is perfect for spooky season. Examine. So the way it works, you got to examine. You examine your patients, mysterious medical symptoms, and review their medical history to uncover hidden clues. Diagnose. Work together to diagnose the conditions, follow the clues, run tests, consult specialists, and use your instincts. And then treat. Make the right treatment decisions to help your patients survive the night. Then work to determine the underlying cause. This is what the back of the box looks like, just so you can see it too, right? So there's 4 cases with 3 levels of difficulty. So there's 4 patients. The first patient is easy rated. The next 2 patients are medium rated, and the 4th patient is a very difficult rating. But for now, I figured for the pilot, I guess, like of a better word, episode, it luckily came with this tutorial. So we're going to go ahead and open this up. It says, before you play, make sure that all tutorial game parts are included in this envelope. You need Nurse Judy's tutorial, a patient form, a patient intake interview, electronic medical records, 14 story cards, 2 status cards, 1 research sheet, and 1 epilogue sheet. I should also preface this by saying these are not going to be our usual episodes, right? So what does that mean? That means there will not be a question of the day. There will not be the Wheel of Fun, right? Those types of things just won't be happening. There won't be any Cards Against Humanity. Do I need a writing utensil for this? It doesn't say I do, but I feel like I might. Give me 1 sec. Got a little mechanical pencil for just in case. All right, we got a bunch of stuff here. So, okay, Nurse Judy says, hi, I'm Nurse Judy. I see you're new here. Let me show you around. Your first patient is Luana Kapuli. Here's Luana, y'all. I probably shouldn't be showing y'all her medical records, but y'all the homies. Let's get her information together by collecting her intake interview, which is where? We'll figure it out. Her intake interview, medical records, and status card, SC1. So, all right, I got SC1. Here it is here. There's a couple of tests, it looks like, that can be run. You will also need story card 1. I found the interview intake. Okay, story card 1. Tutorial research sheet. Okay, that's this bad boy here. Result codes booklet. Oh wait, here goes our intake interview. Okay, I'm gonna need that too. It said result codes booklet. Result codes booklet. Where that at? Oh, it's in the box still. Okay. And a patient form, which is here. So let's go back in this box here. Or I guess for you guys, I'm opening up for the first time since I already opened it prior to retrieve the tutorial. But I need. So yeah, here go all our other patients too. So it says codes, research rules. I don't know if I need this. Is this what it's talking about? Maybe. One result codes booklet. Yep, result codes booklet. Perfect. But yeah, here go the other patient booklets and stuff. These feel thicker. Yeah, damn, they're mad thick. Pause. Anyway, we'll get to those when we get to those. All righty then. Let's go over our inventory more time, shall we? So we need her intake interview, which is right here. We need her medical records. Where are her medical records? Oh, here it goes. Here go her medical records here. So intake form, medical records, status card 1, which is this one. We also need story card 1, which is this one. The tutorial research sheet, which is this, and the result codes booklet. Boom, and a patient form. Boom. All right, now we got everything we know we need. All right, once we got that, Nurse Judy says, put the rest of the items aside. Don't look at them until directed. Directed. So everything else will go right over here. Oh, including this. Let me wrap these all up together then. Review the intake data. Luana status card, SC1, says she is in severe pain. Indeed it does. Take a moment to review her electronic medical record, or EMR, which is this bad boy, and her intake interview, which is this bad boy. Now you can begin taking actions to figure it out. All right, let's start with the intake interview. Luana Capulli. I'm probably butchering her name. 53 female. Patient is a 53-year-old post-menopausal woman of Pacific Islander heritage. She grimaces in pain as she talks. Damn. I was gardening all day. You know this New York summer heat. I should have taken a break, but I had several large orders of herbs that I needed to fulfill for my Etsy business. I think I pulled a muscle in my back, and I'm pretty sure I got heat stroke too, because I almost passed out from the pain on the subway while heading home. I went to bed early. I couldn't sleep, and the pain kept increasing. Finally, I realized I needed to go to the emergency room. Damn, that sounds horrid. So she thinks she pulled her back, and she also potentially has a heat stroke from being in the sun all day. All right, her medical records say she's a self-employed herbalist. Complaints: her face is pale and she appears ill. She is diaphoretic, which means she's sweaty, and her back pain is at a level 8 of 10. She hasn't been sick recently. She hasn't traveled recently. She has no known drug allergies, and she's currently not on medications. Now, I don't know how to, oh, thank goodness. I don't know how to read like blood pressure and things. But her heart rate, I don't know. Her temperature was a 101.8, so she's definitely a little bit feverish. Her heart rate was 112 beats per minute, so her heart rate's probably a little faster. And her blood pressure was 119/75. I don't know what that means. But her past medical history says she does have hypertension, so she has high blood pressure. She is hypercholesterolemia. I'm not going to keep trying. She has high cholesterol. And she has frequent UTIs, which are urinary tract infections. She needs a lot more cranberry juice. Family history, 2 children, both healthy, and both her parents were born in Hawaii. Please turn over the page. So, the exam, the patient has a fever of 101.8 and looks ill, increasing continuous pain in lower back. She is cooperative. Her respiratory is normal, no shortness of breath or cough. Her HEENT, head, ears, eyes, nose, and throat. No changes in vision or hearing. No sore throat or neck stiffness or tenderness. So she's not sick, but she's probably in pain, like she said. And so far the fever probably might be from a heat stroke. She's awake, she's alert, and she's oriented, but she complains of a headache or a sunstroke. Her heart rate is slightly elevated, but no palpitations or chest pain, which is good. Her blood pressure is normal. All right, no murmur. No muscle or joint pain for the musculoskeletal. Her abdomen is normal, soft, non-tender, no palpable masses. Extremities, no swelling or no edema, non-tender. Her skin looks pale. She's diaphoretic, which is sweaty. Her gastrointestinal, no abdominal pain. She's no abdominal pain, nausea, vomiting, or diarrhea. Patient has a frequent history of UTIs, and she is postmenopausal. Okay, so now we're going to take SC card 1. All right, we read all the stuff that we needed to read. See questions and codes. Okay, wait for a second. Okay, actions. Look at Luana's status card, SC1. It shows actions you can take, including running tests. So on the back here, it says blood test and ultrasound, and I can run them at certain times. Prescribing treatments, which looks like on the front, there's antibiotics and other things, and consulting specialists. Remember, there are lab tests listed on the back of the status card. So I can do a urinalysis, I can do a blood test, I can do an ultrasound, I can do a gallbladder removal, I can do a kidney stone removal, I can give her antibiotics, I can give her morphine, or I can consult a gastroenterologist, a nephrologist, or a urologist. You get 3 actions per 2-hour time period. When you've completed 3 actions, you receive an update on the status of the patient. As the doctor, you decide which actions to take and in which order. For your first patient, Nurse Judy will walk you through the process. All right, y'all, so learning experience all together here. Here we go. Action 1. Let's start by asking Luana a question about her back pain. Look at story card 1. Okay. Story card 1. Find the result code next to the question about her back pain. So now we need that booklet. Handy dandy. So, interview for Luana. Question 1. Tell me about your back pain. Where does it hurt? And the result code is BPA. Oh my goodness, thank God this whole thing is in alphabetical order. Perfect. BPA means right on the first page. Take story card 6. Story card 6. Okay. Now, Nurse Judy says the same. Look up the BPA and the result codes booklet to see that you should take and read story card 6. So, I guess it wasn't my whole back, is what Luana is stating. I mean, I hurt all over, but the sharp pain I'm feeling is on the right side. Here, I'll show you. Luana puts her hand on her flank, the area between her ribs and hips. She seems to be indicating the location of her kidney. So she probably needs to have a gallbladder removed. And I'm no doctor. I should probably preface that too. I have no medical history, like no medical degree. I never trained to be a doctor. I don't know shit about shit. This is just a game. We're going to play it, damn it. Okay, make sure to record your performed actions along with the result codes on the patient form. So that's going to help us stay accountable, I guess. So action was what? Asking her about her back pain. Result code BPA. Notes pain near kidneys. Right? So action asked about back. All right. Make sure to record your performed test. All right. It seems Luana's pain, Nurse Judy says, it seems Luana's pain is located near her kidney. Let's do some research to learn more. Take a look at the tutorial research sheet. This bad boy here. There's a front and there's a back. At any moment during the game, you can use the research sheet to assist you in deciding what actions to take. So let's read the whole sheet, shall we? Blood test, CBC. Check blood signs for signs of anemia, infection, or blood-related conditions. This is under the test, header. Ultrasound. Test that uses sound waves to produce images or structures within the body. Urinalysis. Check urine for blood or signs of infection. Pardon me. Specialist. Gastroenterologist. Doctor specializing in the digestive system. Nephrologist or nephrologist. Doctor specializing in the care of kidneys. Probably need him. And urologist, we know what that is. Doctor specializing in conditions of the urinary tract, or PP. Anyway, procedures and drugs. Antibiotics used to treat various infections, which is why I thought she might need the first time until she said her kidneys. Morphine 4, given to reduce a patient's pain level, which she might also need. Surgery, procedure to remove, repair, or readjust organs and tissue, which often involves cutting into the body, which again she might need. Kidney/digestive. Gallbladder attack. I'll put the word on the screen. Inflammation of the gallbladder. A CBC blood test may detect a high white blood count, WBC. An ultrasound detects signs of gallbladder inflammation, and possible gallstones. If they're all painful gallstones, treat by removing the gallbladder through surgery. If left untreated, the condition may lead to gallbladder rupture and even death. Gallstones. I'll put the word on the screen. Hard particles that develop in the gallbladder. Kidney infection. You know what I'm going to say. Inflammation of the kidney due to a bacterial infection. Symptoms include frequent urination, flank pain, fever. A CBC blood test will show a high WC. A urinalysis will show signs of infection. Treat with antibiotics. If left untreated, the condition may lead to kidney failure and even death. Kidney stones. You get the idea. Nephrolitis, whatever. Hard deposits that develop in the kidneys. A urinalysis will detect blood. An ultrasound will detect kidney stones. Treat with pain medication and hydration. Occasionally surgery. If left untreated, the condition may lead to kidney failure. And you guessed it, even death. A urinary tract infection, or a UTI. That one I know. Inflammation in the urinary tract due to a bacterial infection. Symptoms include burning on urination, frequency, urgency, fever, chills, or abdominal discomfort. A urinalysis will detect signs of infection. Treat with antibiotics. If left untreated, the condition will lead to kidney infection. Okay, action 2. It's unclear what Luana's condition might be. Let's consult a kidney specialist. See nephrologist on the tutorial research sheet, which we did. Okay. Look for nephrologist or on Luana's status card. And the status card, that's story card. That's story card 6. Here we go. Her status card. We got it. Look for, so in the first 2 hours, we did, all we did was ask her questions. That was it. Oh no. Oh, we get 3 actions. So we're still only on action 1 for the first 2-hour block. Perfect. Okay, look for nephrologist on Luana's status card. It has a result code of NEP. So now we go back to our book. This is going to be an interesting game to play. Take story card 5. Let's go get story card 5, shall we? You don't got to tell me twice. Tell me one time. Story card 5. The nephrologist says because your patient has a fever and right flank pain combined with the history of UTI, she might have a kidney infection. If she does, it needs to be treated right away. Otherwise, she could lose kidney function or develop sepsis and die. Order stat immediately. A CBC blood test and urinalysis to see if this is the case. If the urinalysis comes back normal, it's probably something else. So right now, I need to go and write this down on the patient form that I spoke to a nephrologist, The code was NEP. And I'm to take a CBC blood test and do a urinalysis. Write this woman's name down before I forget it. All right. Nurse Judy says, don't understand everything the nephrologist said. Refer to the research sheets, which we understand. We got to get a blood test and a urinalysis. Okay. So, don't forget to take note. Yeah, I took note, Nurse Judy. I got it this time. There's a few actions on here, y'all. We're almost. I lied to you. If Luana has a kidney infection, it needs to be treated immediately. Let's find out if that's what she has. Run a blood test. Check the back side of Luana's status sheet, which is nope, not that one, not that one, not that one. It's this one. Okay, we're gonna turn it over. Check the backside of Luana's status card to see the test result of a CBC blood test between midnight and 1:59 a.m. The result code should be BLT. Look it up. Bacon, lettuce, tomato. The test shows she does have a high white blood cell count. So that means it could be it could be a kidney infection. A CBC will show that, but the doctor also did say if the urinalysis comes back normal, it might not be that. Okay. So, blood test. And it showed BLT, high white blood count. You've completed 3 actions. It's now 2 a.m. and time for an update on how Luana's condition has changed over the past 2 hours. Look at the update section on Luana's current status card. The result code for 2 a.m. is TAM. Oh. Take story card 10. I thought these were in order, and they might have been before I started messing with stuff, so let me stop talking. All right, Luana. Let's see what's going on with you now, girl. What's going on? Update, 2 a.m. Luana begins to moan in agony as her pain increases to a 10 out of 10. Her condition seems to be getting worse. You need to figure out the cause of her symptoms. Well, damn, I thought I was trying to. She seems to be in a lot of distress. If she wasn't in so much pain, this might be easier for her. I think they're going to suggest that I give her some meds. We're probably going to dope her up in a second. As the update explains, Luana's condition is getting worse. Let's take care of her pain with the morphine 4. Called it. Find the result code for morphine 4 on Luana's status card. The result code, no, don't tell me, it's PMI. So for 2 a.m., morphine, PMI. PMI says, take story card 9. Wow, I'm sorry. Sorry. You prescribe a morphine 4 to help with Luana's pain. It acts quickly, and Luana is clearly much more comfortable now than she was when she first arrived. Nice. However, because her pain has been increasing, her condition is likely getting more serious. You need to figure out what is causing her symptoms. Take status card 2. Calm, but condition unknown. Status card 2. Calm, but condition unknown. So I'm going to put status card 1 to the side for now since her condition has changed. Status change. Excellent. Treating Luana with a morphine 4 has changed her status to calm but condition unknown. Replace status card 1 with status card 2 as directed. And I did. From this point, you have the skills needed to continue this case on your own. You can always come back to this guide if you don't know what to do. Oh, I'm going to keep using it. Action 5. With Luana doing better, let's run the urinalysis the nephrologist suggested. Find the result code for urinalysis in Luana's new card. So, urinalysis. CPP. Let's see what CPP says. I guess we did CPP, didn't we? Was that too immature? I don't really care. The test came back normal, so it's not a kidney infection. The urinalysis came back normal. This is good. It means Luana doesn't have a serious kidney infection. However, the high WC on the CBC blood test suggests she might have a gallbladder issue. Run an ultrasound to confirm. Find the result on the Run an ultrasound. So ultrasound, we're going to run that at 320. So that's between 2 and 4. So DJE is what it says. DJE. Take story card 3. You share the ultrasound image with the gastroenterologist. Ah, she says. Not a kidney infection or kidney stones. Luana has gallstones. And from her symptoms, it's clear she has a gallbladder attack. And a gallbladder attack means inflammation of the gallbladder. Cool. And she does have gallstones, she says. So we'll probably have to do surgery anyway. Okay. That sucks. So gallstones and attack. All right. You've completed 3 actions. It's now 4 a.m. and the time for an update on her condition. At 4 a.m. it says YWE. And YWE says her condition is unchanged. Okay. I get 3 more actions before the next update. She has gallstones, which have caused inflammation of her gallbladder. According to the kidney/digestive research sheet, she needs surgery. Yes. Choose surgery. Choose surgery, gallbladder removal. For your next action. Okay. We're going to get her gallbladder removed at 4. And it says GBR. So let's see what GBR says. What GBR got going on. Take story card 12. So it makes me wonder if anyone else is going to have gallbladder problems. Congratulations. You have helped Luana survive the night. You call in the gastroenterologist to perform surgery on Luana to remove her gallbladder. The surgery is successful. Luana is now in recovery and doing beautifully. All that's left is to fill out your final report. Take story card 13. Final report. What is your diagnosis of Luana's condition? She's fine now. What treatment did you provide? We gave her morphine to help her with her pain. We did a blood test, which confirmed a high white blood count. We gave her a urinalysis, which came back normal, which, excluded a kidney infection. But an ultrasound confirmed that she had gallstones and a gallbladder attack. Let's see if I'm right. Luana survived the night. You achieve your primary goal, helping Luana to survive the night. If you had just treated her symptoms without knowing the underlying cause, she'd be back in the hospital with the same problem later. If you need to, you can keep testing a patient after they are stable to make sure you understand the source of their symptoms. In Luana's case, you correctly diagnosed her condition and prescribed an appropriate treatment. It's time to fill out your final report, which I think is somewhere. Oh, here it is. It's in the back of this. I'm not going to fill it out. We already talked about it. The epilogue describes the key details. Oh, she has an epilogue. Oh, I did know that. It's this other sheet over here. All right. Talking to Luana, you discover her pain is focused on the right flank of her back. Her history of UTI suggests she might have a kidney infection. In addition, her CBC blood test shows a high white blood count, which could indicate several different conditions. A urinalysis confirms she does not have this life-threatening condition. An ultrasound reveals she has high gallbladder inflammation and gallstones. With her high level of pain, the gallbladder needs to be surgically removed. Luana's, so you also get points scoring. So I'll think of a score system for the next episode so that way we can get it right, or like maybe like a punishment system if someone dies, whatever, or maybe we'll figure out like if I have X amount of points by the end of it, something will happen. So score plus 50 points if Luana survives the night, plus 25 if you remove the gallbladder, which we did, so 75 points, plus 20 points if you first made sure she didn't have a life-threatening kidney infection, which we did, plus 5 points if you offered pain medication to relieve her stress, which we did, and minus 5 if you tried antibiotics or kidney stone surgery, which we did not, which is obviously because the game told us not to, which means for the next game, y'all, it's all on us. Well, all on me, and we'll figure it out together. But for now, it's been real. I took up so much of your time. Make sure you like, comment, subscribe. Until next time, this is King Echo, signing off.